Hello, you're watching Eye on Africa on France 24. I'm Clarisse Fortuné. Coming up on our program. Ebola is spreading faster in the DRC than in any previous outbreak. So why is the response struggling to keep pace? Can new vaccines and treatments change the course of the epidemic? WHO's Dr. Marie-Rosaline Belizaire joins us with answers. Russia's war recruitment drive is reaching deep into Africa. New data has identified nearly 3,000 Africans recruited to fight on the Ukraine front, with around 1 in 6 already killed. Cameroon, Ghana and Kenya are among the countries most affected as Moscow continues to draw foreign fighters into its war efforts. And Algeria is battling a wave of devastating wildfires. Extreme heat and prolonged drought have fueled dozens of blazes across the country, with authorities reporting more than 130 fires in a single day. Ebola continues to dominate the headlines. 2 months after the Democratic Republic of the Congo declared an outbreak, the situation is deteriorating at an unprecedented pace. More than 2,000 confirmed cases and nearly 800 deaths have already been recorded, making this the fastest growing on record. And the World Health Organization warns that many chains of transmission remain undetected. So to help us understand the scale of the crisis, we are joined by Dr. Marie-Rosaline Belizaire of the WHO. Welcome, Dr. Belizaire, and thank you for joining us. So first, let me ask you, so how would you assess the current situation in the DRC?
So actually, the current situation, as you mentioned, continue to expand. The outbreak continue to expand and continue to bring on concern. So as of 14th of July, so the outbreak has been, the DRC has reported more than 2,073 confirmed cases and more than 796 confirmed deaths. That means it is a growing case of fatality rate. That means the lethality of the outbreak is also increasing. If you recall, we started at a very low mortality at 17%, and now we are at 38.4%.
So I mentioned earlier, your organization, the WHO, says this is the fastest growing Ebola outbreak on record. So what explains such rapid transmission?
So effectively, as you can see, this outbreak is expanding very quickly. So at 60 days after the outbreak was declared on the 15th of May 2026, we already have more than 2,000 cases registered and more than 700 deaths. So when we look at, for example, back the epidemic in 2018 and 2020, so we reached 2,000 cases after 11 months. And when you look at also back in 2016, this number of cases were reached after 9 months, more or less. So that means it's the first time after 2 months and 60 days that we have 2,000 cases in an Ebola outbreak. So there are so many factors that can be considering as a driven factor. So one of them I can say is the delay detection. So there is a study that has been conducted by the National Institute of Biomedical Research in DRC with the genomic sequencing that show clearly that this outbreak has been there since February, while the detection was in May. So that means we have a very long delay in detecting that outbreak. So the outbreak has time to become a community outbreak. So the time the outbreak was declared, it was already a community outbreak. So the reason why we're still having a community death in this outbreak. So other factor also I can mention is the delay that we notice in the community, the delay to seek for care, the delay to go to healthcare center. So you know that when you early access the healthcare center with Ebola, the probability of survival is higher. And when you come late, for example, at the phase where you start with hemorrhagic symptoms, so the prognostic is very, I can say, low to save the life of those people. So there are also other factors that has been there. For example, one of them is the insecurity. You know that the outbreak is happening in a province that is under siege. So that is
and I was going to mention that
government.
I was also going to mention that actually recently Bunia, the treatment center in Bunia, was attacked. You had just left Bunia actually in the Ituri province, the epicenter, where you were the first one to organize a response. So I'm guessing this has an impact as well on the outbreak control efforts.
Absolutely. So the impact is really important because when this center was attacked, we have 4 confirmed patients that went to the community, even though they come back, but they were in contact with the community while they were confirmed. And also one of the impact is the fear that this attack will cause now in the frontline workers.
So let's bring some hope. Let's talk about treatments. Several clinical trials for vaccines and treatments are now underway. What can you tell us?
We have 3 major clinical studies that are currently underway. And it is, as you see, it is a very big hope that we have. The first one is the Oxford vaccine, a trial that has started. This is a study together with CEPI and the University of Oxford and the Vaccine Development Group. So they will start on the phase 1 of this clinical trial. So this is a very good hope. And this vaccine is really to see whether it is safe and capable of generating an immune response that could protect people being infected. The second one is the WHO-supported partners trial. So this is to test the monoclonal antibodies and also the remdesivir. So it will be in combination or one of them to determine which treatment is more effective at reducing death and also at improving survival. And the third one is what we call the EboPep. The EboPep is for post-exposition prophylaxis. So it is being done with the drug obeldesivir. It will be given to people who were exposed. So those who we call high-risk contact, that were in contact with a confirmed case, but they don't develop the disease yet. So they will receive this treatment to make sure that this can protect them of developing the disease.
Dr. Belizaire, we will keep monitoring these trials and the results. Thank you very much for your analysis, Dr. Marie-Rosaline Belizaire of the World Health Organization. Thank you very much.
Thank you.
Now, Russia continues to recruit Africans to fight on the Ukrainian front. The Stop Russian Recruiters platform, which is linked to Ukraine's Ministry of Defense, has now identified nearly 3,000 recruits and says that around 1 in 6 has already been killed. Among the countries most affected are Cameroon, Ghana, Egypt, and Kenya, where Bastien Renouille has more.
According to the platform, its findings rely on documents found on the bodies of fallen soldiers and also on military personnel lists obtained by the Ukrainian intelligence. And these data show that the number of Africans killed on the front line in Ukraine is still increasing. And that might be surprising for Kenyans. You know, at the beginning of the year, when the recruitment campaign was made public, it created a major public outcry here. The Minister of Foreign Affairs, Musalia Mudavadi, had to travel to Russia. He met with his Russian counterpart, Sergei Lavrov. And at that time, the Russian authorities said that 19 Kenyans had been killed and that it will no longer recruit Kenyans. Apparently, it was not true. According to the platform, 59 Kenyan soldiers have now been killed, and local NGOs and the platform now say that the recruitment campaign is still ongoing. At the beginning, it was done on the ground by a recruitment agency, but it was dangerous for their agents. They risked a prison sentence. So now it's mostly done online on social networks. It's less risky for them, and it's easier to reach out to many Africans across the continent.
French Prime Minister Sébastien Lecornu is in Morocco this Thursday for high-level talks aimed at strengthening ties between the two countries. Franco-Moroccan relations are on good terms now since France recognized Moroccan sovereignty over the disputed territory of Western Sahara. Catherine Diet has more.
Rolling out the red carpet in Rabat for Sébastien Lecornu. The French Prime Minister is making his first visit to Morocco to cement France's diplomatic reset with the country 2 years after Paris recognized Moroccan sovereignty over disputed Western Sahara. A decision French President Emmanuel Macron reaffirmed before the Moroccan parliament that same year.
For France, the present and future of this territory lies within the framework of Moroccan sovereignty.
The move significantly eased tensions between the two countries, which had been at odds over visa restrictions, judicial cooperation, and intelligence sharing. Accompanied by about a dozen ministers, Lecornu is holding bilateral talks with his Moroccan counterpart, Aziz Akanouch. Cooperation with Rabat regarding security, migration, and judicial matters has resumed, while new French investments and partnerships, particularly in the defense and civil nuclear sectors, are on the table. According to the Moroccan media outlet Le Desk, the mega project to link the French and Moroccan electricity grids is also on the agenda. These talks are intended to pave the way for King Mohammed VI's expected visit to France this fall and for the signing of a treaty establishing a so-called exceptional partnership between Paris and Rabat.
From Morocco to Algeria, where at least 11 children have died after a fire tore through an orphanage near Algiers. The blaze broke out at a 2-story childcare facility in Mohammedia. Rescue teams safely evacuated 5 children with reduced mobility. The cause of the fire remains under investigation. President Abdelmadjid Tebboune has expressed his condolences to the families affected. And meanwhile, across the country, wildfires have been raging, where extreme heat and prolonged drought have fueled dozens of blazes. Authorities say more than 130 fires were reported on Wednesday alone. At least 1 person has been killed, and the damage has been devastating, especially for farmers and livestock owners. Eloise Melon and Natasha Lee have the story.
Water bombers circle over Béjaïa as firefighters battle multiple wildfires burning along Algeria's northern coast. Hundreds of hectares have already been reduced to ash. The fire has caught these farmers by surprise.
The winds picked up around 1 o'clock in the afternoon. By 1:30, the fire had reached our area, driven by very strong winds. Local residents came to help us fight the flames, but their motorbikes burned, along with the electric motors powering our chicken houses. I've suffered heavy losses, just like the beekeepers in the area.
Amid the smoldering ruins of the family farm, they recovered the carcasses of animals that couldn't escape.
There were about 20 sheep and goats here, along with hay. We also lost a donkey. The fire was so intense its bones melted, and so did the bones of other animals. Even the metal melted.
Firefighters have been battling the blazes around the clock, with the military brought in to support the effort. Officials say more than 930 fires have broken out across northern Algeria in the past week.
These major fires have been driven by soaring temperatures, the heat wave and strong winds affecting several regions. We're responding to between 120 and 130 fires every day, burning forests, scrubland, agricultural land and palm groves.
Wildfires are common in Algeria during the summer, but they have been unusually severe this year. The Agriculture Ministry says the blazes have been intensified by dense vegetation after heavy rainfall, providing more fuel for the fires.
And we've reached the end of our program. Thank you for watching Eye on Africa on France 24.